I see, so it's not necessarily an employee of yours.
No, it is an employee of ours.
Okay.
The recovery coaches are the employees.
Okay, so it's but what if they don't know where they're going? Who can they get out of rehab? Who is their recovery coach?
Well, they would have to, so they apply to our program.
I see, and then once
There's an
that happens.
application that comes through,
I
or a
see.
referral from a case manager, or they show up to the Friday night events. A lot of the people that come are from like the halfway house or work release.
Mhm.
And one of their friends in the halfway house has been coming, and then they're like, oh, I get to get out to go have dinner and do these activities. Yeah, I'm gonna do that. And then they come to us, and then they get introduced to the recovery coaches, and then it's, hey, here's what our program is.
Okay.
And then we bring them in to do the intakes, the biopsychosocial assessment, all of those things.
Interesting.
And then they set up their treatment plan goals with our clinician, which then they coordinate with the recovery coach on how to meet those goals during the 90 days.
Okay, because I was a little surprised at the amount of money in that category, so that
Yeah, and
explains
that's-
why it takes.
And with the recovery coaches, it's actually a pretty low amount because by the time the recovery coaches are about 2 months into working for us and they're adjusting to our system and the flow of everything, because we bill Medicaid for the peer support services, the Medicaid reimbursements are paying the salaries and all of the administrative costs of having a recovery coach. So really our goal was to hire 2 coaches and we hired 7.
Right, yeah.
So for almost the same amount of money that we were gonna do 2, we tripled the amount that we were able to hire using basically more or less the same amount of money.
Thank you.
Yeah.
You keep mentioning that you're billing Medicaid.
Yes.
Are you concerned about funding for next year, given what's coming out of the federal government on funding?
Fortunately, not up here.
Okay.
Because Colorado Access was the one that got cut a lot, and that was all the Denver metro area. And everything that switched region-wise is under the Northeast Health Partners, and Rocky Mountain now falls under that. And there wasn't the financial cuts that there was to Rocky Mountain that there were to Colorado Access. Now, whether that stays or not, I don't know for sure. But I mean, I've met with some people from Rocky Mountain. I was down in Denver at the state capitol for that, and they didn't give me any indication that the rates on it were changing. So as far as it is now, I don't think so.
Yes.
Thank you. How are you monitoring substance use for the sobriety statistics?
So, I mean, when they're in sober living, they have to be doing UAs, urine analysis.
Yeah, but how often is that?
Weekly or twice. I mean, for our houses, it's twice a week. And then, being in the recovery world, everybody knows when somebody's not doing what they're supposed to be doing. It's not a hidden thing.
Yeah. And then follow-up wise in terms of after they're leaving the facility, what is that sort of communication look like?
So we do follow-ups so we do the survey tracking on 90 days, 6 months, 1 year, and 2 years. And so we have our administrative operations person following up with them specifically on those dates. But once they're in our system as far as the email updates and the text messaging, because everybody's the way that we organize events is through the confirmed text messages. And so once they're in that, they're still on the list. They're getting invited to all the events that we're going to. They're getting invited to all the programming things and everything else that we're going on. And so we're able to stay mostly in contact with people once they're out of the program.
So at that point, it's like self-report plus
Right.
personal information that you all might have about them.
Correct.
Have you encountered situations where someone is self-reported sober, but the information you have within the community is that that's not true?
There has been people that have gone to a marijuana maintenance program, if you want to call it that, and have stated that they were sober or not. So yes, there has been that, but it's only been 2 or 3 people so far. But it's a valid question. That's why I would say with any of the percentages, there's probably an 8 to 12, 8 to 10% fluctuation in what the actual is one way or the other. Yeah. Percentage of error, I guess. Yeah. So yeah, vision for the future, continue tracking the things that we're tracking, the expanded social connection events. We're trying to do more stuff in the Denver metro area too. We're trying to get a lot more connected with some organizations down there that are doing bigger events that are affecting things on the state level. Because that seems to be making a big difference. It's like really showing on a statewide level how many people are in recovery and not keeping everybody separate from what they're doing. Increasing sobriety rates, the self-sufficiency rate to over 60, strategic partnerships, diversifying our funding streams because of the Medicaid situation is trying to figure out where we can get more corporate sponsorships or private donors, social enterprise, those type of situations where we've been looking into that recently and trying to figure out kind of what other things are available or what ways we can start using data tracking and some of these AI type of services. There's different like Garmin type watches and these type of things that are coming out to be able to track and monitor people's physical attributes as they're getting sober. So there's grant funding available for those. We're trying to work into some corporate partnerships that are, you know, when it comes to technology, these grants are in the millions of dollars to track those type of things. So there's opportunities out there. It's just really trying to go through and pay attention and find those things. But we work with the Arula grant writing team, and they're always looking for additional funding sources for us.
How many clients do you currently have?
About 145, I believe, that are active. So like in that active status right now. If you can go to the next one. Yeah, so this just is a programming budget. Shows where we're at on the programming budget of things. Yeah, that's where the personnel was higher on that. Because we had talked at the 6-month mark that we are under on the housing budget. So we actually used the housing budget to expand in the coaching factor. But that's where we can see on that where the actuals are lower than what a full-time salary would be because they eventually end up getting covered by the Medicaid reimbursements. The direct costs of the weekly activities, the dinners, fitness memberships. We do a lot of stuff. We've Title Boxing just sold their organization to a different boxing club called, can't think of it off the top of my head. But we just partnered with them, so we're still doing the boxing classes. The women are doing dance and dance fitness inside the Larimer County Jail and then also outside of the jail too. So people are able to still stay plugged into the women's part of the program from jail and transitioning into our program. Equine therapy has been a hit. We've continued to do that. When it's nice, the nice seasons like this, we can usually get in 2 rounds of women and 2 rounds of men for the equine therapy. So that's been super beneficial. People have really been into that one.
Who are you using for the equine therapy?
Lisa Pugh. She it's Hearts and yeah. Okay. Yeah. So she's been great. People love. What's really been cool is people that are afraid of horses when they go into that program and the growth that they have by like just going through that over a 6 to 8 week.
There's a lot of you to say that around. Not only just equine, but animals.
Animals, yeah. Yeah. Can you go to the next one? The housing budget. So this is where we are under on that. The housing utilities expenses.
Is that,
Yes.
can you explain why you were under? Because I know, you know, you're.
Because we
wanting to give more
hadn't
housing.
opened the we haven't done more of the women's housing by the point of the 6 months.
Oh, okay, so that still went forward. into
Yeah, so
that.
that's just, and that just continued on into now, but it still left us under budget for that, but it gave us the ability, because and really we factored it into the coaching cost because of the Medicaid situation. We weren't sure what was gonna happen with that, and so it was like, we're gonna have to make sure that we're budgeted for who we have staffing wise, and then it didn't really change for us, so we benefited by just having additional staff at that point.
But you're still moving forward with the women's
Yeah.
housing.
Yeah.
And where are you gonna get those funds from then? If you took them and put them to
So that allowed us to be able to just continue to scholarship people in our houses and the other houses. But we've just been able to build additional income from our housing sector in general. So we have money to be able to put towards the down payment on it. We're actually working on another property to get remodeled for that now.
So I'd like to build, I had a different question on the previous slide, but I'd like to build off of trustee Young's question is, I thought we had in our agreement that you had to spend that on women's housing. Did we change that with the agreement? I thought the agreement said it had to be spent on women's housing, and I didn't know we had approved it being able to shift the salaries. I'm trying to think, did we approve that?
I had it in my notes as shifting.
John, are you online?
Did we vote on that?
Because I mean, we still were scholarshiping the women in the sober living level with the scholarship funding. But we had set aside the additional funding that wasn't used at the 6-month mark for that.
Yes, I'm on.
There you go. Cool.
Can you repeat the question? Is it about the budget?
Thank you, John. When we first originally approved this, we had said that, and I think we remember, we had there was an ask, and we had specifically said we wanted to make sure, because we had been excited about this because of the increase to support women housing, and so we said it had to be a certain, I don't remember, I think it was half or a certain amount for women's housing. And then I think it had come back that there was a challenge, but I think we still tried to, I don't remember us voting to say it could shift to salaries or something. Do you remember that?
So the contract was written up that it's a goal to be more than 50%. That's the way it was. It didn't have to be 50%. So it was a goal to be at 50% or more. The ROAC's policy is you don't have to get approval for a budget revision until it reaches $50,000. So I don't think there was an actual formal motion. But it was brought up and discussed.
That was okay to shift?
They can. The contracts say that you, and our policy says you can shift up to $50,000.
Okay, thank you for clarifying that.
I just had it in mind from that because we wouldn't be able to use the amount that was set aside in the next 6-month time frame. Right, we wouldn't be able to make up for it within that amount. It would have just been left over. That was the reason for shifting into that.
Yeah, and I understand all that. It's just, we have been excited because we wanted to focus on helping women, and you can come in and make a proposal and, yeah, we know conditions change, but we just don't want to see that too often, that, you know, you kind of come in proposal and then it kind of shifts again, and I just like to make sure we don't see kind of, especially if we're starting to look at equity and trying to address other subgroups, I think we should maybe be a little more thoughtful with our conditions going forward. I just wanted to say that, thank you.
Do you know the census, what percentage were of women on the housing piece?
It was the majority, I believe 64%.
Okay.
So I mean,
Excuse me. That was what he reported at the 6-month. You did report the number of women, and I do remember it being over 60%.
Okay.
Yeah. Okay. So I mean, we stayed on track with it. It's just that if we hadn't, that's why I proposed it before, because if we hadn't used it, the money would have been left. If we would have, because there wasn't anywhere to force it into to support that. And it was, I mean, the extenuating circumstances at the time were out of our control.
Doing a time check, is there any other questions for the grantee? Do you have anything further?
No, I mean, I just would, I mean, support the multi-year funding moving forward if that ends up being an option. Based on what we're seeing on numbers, that multi-year tends to be a pretty good way to go about funding.
All right. Cool. There aren't any further questions. There is an action required here. If anybody wants to make that motion. On accepting the Abundance Foundation's final report.
I'll make the motion to accept the final report from the Abundance Foundation.
We have a motion, is there a second?
I'll second.
A motion and a second. Any further conversation? Hearing none. Anybody oppose that motion? And I'm making sure Trustee Mason's, his hand is up there. I'm
No,
making sure.
you're good, Chair. We're good.
All right. Hearing none, that passes unanimously. Thank you for what you're doing in the community. Thank you. All right, moving along to our second final report. That'll be the Sheriff's Office on the co-responder work.
Good afternoon, Mr. Chair, members of the council. Doing good. Thank you for the opportunity to be here today to kind of help present our final report. We don't have a PowerPoint to go along with this, so I'm just going to cover a few points because a lot of the data is going to be the same from our last presentation at the 6-month mark. Really, in this final report, we just want to thank the council for all the tremendous support we've received, both individually as council members, but also as a council collectively, for us to be able to expand our unit over the last 2 years and to try to meet the needs and provide co-response services to more people in our community when they experience a life crisis event, such as substance use, mental health crisis, or a combination of both, which often is the case. As you guys may know, and I should stop right now because I know there's some new council members that may not know who I am. I just realized that I meant to introduce myself. Robert Cook, I'm a sergeant with Larimer County Sheriff's Office. I also supervise our Larimer County Sheriff's Office co-responder unit. I have with me in the back Lieutenant Jeff Van Hook. He's the lieutenant oversight of the program, and he's here to help answer questions if you guys have any at the end. So just to continue, as you guys know, many of you know, we started in 2018 with co-response at the Sheriff's Office with one team that included a Summit Stone clinician and a deputy sheriff that was who were selected specifically for their experience and their crisis knowledge and training. We now, after our expansion and by utilizing the funds that have been directed by the council, have 5 teams total that include a clinician and deputy working together to respond to those life crisis incidents. That also includes our youth crisis response team, which is basically co-response in the Thompson School District in collaboration with Thompson School District and the Sheriff's Office. As you guys know, these crisis incidents, when we respond to them directly with our primary response model, we truly meet people where they are in crisis, and we try to provide those life-saving efforts. When I talk about life-saving, that's really what our primary goal has been and continues to be. We talk about that both literally, because there have been some incidents where our people who were there as part of this expansion as a result of the funding that we received from ROAC actually provided life-saving efforts in administering Narcan and also providing first aid and life-saving measures. The other part of our life-saving that we do on a daily basis is really try to help those people in crisis who may be suicidal or may have other serious mental health, substance use issues, or a combination of both, get connected to the resources that they need in order to work on improving their quality of life and hopefully preventing them from becoming suicidal. So as you know, some of these incidents can range from just helping somebody get connected with counseling all the way to like a substance use overdose. So one of the things we've been able to do, thanks to Longview, is bring these people directly to get the services that they need in an emergency situation. And especially when we're talking about substance use, access immediately to medication-assisted treatment, which we know has some research-based effectiveness that has been proven. So our current staffing includes one team that includes 2 Thompson District clinicians. That was one change that has happened in the last couple months, is that Thompson School District has terminated their contract with Summit Stone to provide the clinicians. They've hired their own clinicians now as a cost-saving measure, just due to their budget shortfalls that they've had in Thompson School District. So they have hired 2 of their own clinicians. However, we're still committed. We're involved in providing that deputy. And that team of 2 clinicians and 1 deputy respond to all the calls within Thompson School District involving school-age children who are suffering crisis, both either at school or at home or at both locations. We also have 4 deputies and 4 clinician positions that are assigned to our regular co-responder unit as a result of the expansion. We have been able to provide coverage and co-response services from 7 in the morning until midnight, 7 days per week. And as you guys know, with the funding and the expansion project, we're able to hire those 2 additional deputies to expand our unit, and also a corporal. Steve Fay is our corporal assigned to the unit. He has been instrumental in helping lead the unit, and has also worked very hard to increase our data metrics collection and made our reporting more streamlined, more accurate as a result. He's also worked really hard to expand our presence on the internet with our webpage. We have a very comprehensive mental health crisis and substance use crisis information on our website that thousands and thousands of people have accessed, because we actually record how many people actually visit the website. And that is really kind of like an additional way for us to support people in the community who may not feel comfortable calling 911 or accessing crisis services. Over the past 2 years, ROAC has provided about $1.1 million to fund the additional law enforcement personnel. At the same time, Lamar County Behavioral Health Services has also funded an additional clinician position and a clinician supervisor, so that we've been able to fully expand our unit, both on the deputy side and the clinician side. Those funds have helped us create the clinician supervisor position, and also another clinician position to match up with our deputy, who are then put into teams and sent into schools. Like I said before, Thompson School District has been a partner for the last 2 years in helping us establish the youth crisis response team, and they have taken on the cost of hiring those 2 clinicians themselves. The Sheriff's Office contribution to that is basically the deputy that we provide in order to provide those co-response services in the school district in Thompson. So really, collaboration has been a big part of our success between Summit Stone, the Sheriff's Office, Thompson School District, Lamar County Behavioral Health Services, and ROAC. Really, we couldn't have been this successful as we have been without that collaboration and that support that we've received from our partners. I want to just cover a few data points just to remind you guys of some of the success we've had. As you know, one of our goals in co-response is to decrease the number of unnecessary arrests and incarcerations. We're about 2.4% of all the people we contact actually end up in jail. Usually that's because of a serious warrant that may be in the system from a previous contact, or it could be the seriousness of a criminal charge that may be involved in their crisis situation that we're responding to. We also have minimized the number of people that we put on involuntarily holds to about 52% of the people we contact. And with those remaining 47%, what we try to do is we try to keep them in their home with support from family and friends, and then also with a verified safety plan for if things change or they become unstable, they can always call us back. But that's really a goal, is to try to decrease the number of hospital visits. And again, with Longview being a partner with us now, that has definitely been very effective. As you may know, also about 33% or 1/3 of our contacts, of all our holds that we've put on people, including emergency commitments, are actually emergency commitments. So we're dealing with about 33% of the time of crisis that involves substance use, which I think is important to know. And finally, our co-responder unit has handled about 68% of all the calls that come in to the sheriff's office related to mental health or substance use. So the rest of that allows us to allow the rest of our patrol section to respond to crimes in progress or other criminal matters and deal with those situations. As you saw in the report, our goals and objectives were all met at the end of this 2-year. I think the second year of grant funding, our budget includes all the information in the report. You probably saw that we expended all the funds in accordance with what our goals and plans were. And then just in conclusion, I just want to thank you guys again for all the support. Thank you for the continuation of funding and partnering with us in order for us to be successful. Truly, this comes from everybody who's on the unit. Sometimes we have a lot of hard work that we do. It's sometimes very heavy, but our people are dedicated both on the clinician side and the deputy side to make sure that we are truly there to try to help and not harm. So that has been a great success at the end of the 2-year mark. And we just want to tell you guys again, thank you for all the support.
Thank you. Any questions? Yes, Rupa.
So the metrics and the calls for service numbers that you referenced, that's only within Laramie County Sheriff's Office jurisdiction, right? Or are you tasked with helping other?
We do sometimes assist Fort Collins or Loveland, sometimes due to the fact that there may be a crisis going on with Fort Collins and their unit is tied up. Sometimes we respond and actually help them at their request. Or with Loveland. We've also helped in Estes on a few occasions when their clinician wasn't available. But we also work pretty closely with those other teams. But to answer your question, yeah, the data and the stats I'm talking about are specifically from our unit, which we mostly cover unincorporated Laramie County and respond to those types of calls.
Okay.
Chris Jones has raised his hand. Chris Jones has raised his hand.
Oh, wonderful.
Yeah, I had a second question. So what is the continuation of funding? Is it through 2025 and then we re-up 2026 in October of this year? Or what is?
So we're at the end. Well, this report is at the end of our second year. The third year funding was reduced to, I believe, 284,000. So we're funding those 3 positions at about 62% for the third year of our grant, of receiving the grant from ROC.
Before, also, don't you cover town of Wellington and the town of Berthoud as well during their police?
So we contract with those towns for public safety services.
That's all.
Hi, Chris, your hand is up, I understand.
Hi, thank you. Thanks, Sergeant. I really enjoyed your report. And what I was thinking about is how are you feeling, all of you, about the community now getting used to you, your presence and showing up as co-responders? Are you noticing like a better acceptance of what your teams are doing?
Absolutely. We actually have repeat customers, as you can imagine, who sometimes have chronic conditions which they're suffering from mental health illness, substance use, or co-occurring conditions. They may not be holdable at the time that we make contact with them, but they are used to now calling for a co-responder deputy or co-responder team to respond instead of a regular patrol deputy. So part of that answer is that we've worked hard to try to get information out to the community, in that we do have a co-responder program, and a lot of that is on our website. So when people are directed to our website, they can see that they have a good understanding after looking at what our co-responder unit does, how it works, exactly how a call for assistance might go, working with a co-responder unit versus a regular patrol deputy. So we have noticed an increase in people asking, first of all, knowing about co-response, and that includes family members of people that have loved ones who are experiencing mental health or substance use, where they are specifically asking for a unit more and more. So I think that's a good sign that shows that the community not only has accepted that, but really kind of relies on that service, and that our agency provides that service.
I'm so glad to hear it. I'm finally hearing more about it in the community a little bit in Loveland. So that warms my heart just to hear that people are understanding what it is and they're not so afraid
Yes.
to make that call or to look you up. And then my other question really quickly was, do you have an idea of how many men or women you're serving, or if there are any veterans, for instance?
I don't have those stats with me right now as far as broken down between male or female. I can get that information for you guys if you'd like me to. I could definitely bring that information back or send it out to you guys. But I will get that information back to you. As far as your question about veterans, we do very, we do actually have a lot of calls that involve veterans. And we have worked really hard with the Veterans Center in Loveland to coordinate. Actually, one of our former co-responder clinicians is a clinician there now. So we have a good connection there. We also, just a couple weeks ago, part of the team went and toured the VA center there, met a lot of their staff, and we were introduced to some of their peer counselors. So we are always trying to work more closely with our partners like the VA center and trying to get the kind of help that veterans need. Many veterans don't even know that they qualify for some of the services. So I think that's a big part of what we try to do is educate them about what resources that they are entitled to and what resources are available in the community. So we also have one of our deputies is a U.S. Air Force veteran, and
Yes.
he has kind of taken on the role of being our veteran connector to the community, and has had really a lot of good success and really de-escalating veterans when they're at the point of having suicidal ideation or making suicide threats. So we are very focused on veterans, and we want to do the best we can for them, as well as all the other people in the community that need the assistance they need.
Thank you. I can always talk to you more about that. Thank you so much.
Absolutely. You're welcome, Commissioner.
Yeah, thank you, and thanks for the report, and really exciting work. And I've been able to kind of see these things, and I'm just so impressed. With last time you came before us, you had shared that actually one of your deputies had deployed Narcan and saved a life. And I'm wondering, just anecdotally, you can't probably track that with some of the data, but is that still some things that you're seeing out in the field that you guys are still deploying Narcan and?
Yeah, no, we do deploy Narcan like our other patrol deputies. All of us carry Narcan on our vests. Got mine right here. And there are many occasions where our deputies do that. There's several incidents that I know of. I can't give you specifics right now where our co-responder team members have deployed Narcan. The other thing we do is we get a supply of Narcan from Summit Stone, and we're able to distribute that to people that we encounter when they ask for or they need those kind of resources. So we're also providing that, or I should say our clinicians are providing that because they have that as a resource that they can actually distribute to the community. So that's kind of the other part of it. But we do, and we have on several occasions deployed Narcan to try to bring somebody back when we believe that they've suffered an overdose.
Thank you for that. And next question, if I might, Mr. Chair. You had talked about before kind of how you would, your deputies in your co-respond unit spend a little bit longer time with folks than normal deputies who are, out in the field, and they kind of get back into the system available for other calls because you guys are kind of covering a large area. Is that still kind of those numbers holding, that you spend quite a bit of time with those folks as you're de-escalating or getting the right appropriate care, or following through like a few days later with that safety plan follow-up? Is that still kind of those numbers holding from what you had tracked before?
Yeah, I think the last time that I looked at that stat, we're about 69 minutes per contact, which if you compare that to like regular patrol deputies, it's going to be a lot less. But there are times where we spend 3 hours with somebody, sometimes trying to de-escalate them, trying to convince them to voluntarily come with us to Longview, instead of like involuntarily taking them against their will, because we're really trying to get them to accept the help themselves. Sometimes that's not That's not always effective. So sometimes we do have to involuntarily take somebody and put them on a hold. But we really try to get them to go voluntarily with us first before resorting to that, because sometimes that can result in like a conflict, a physical altercation, that type of thing. So we're also very careful not to be in a situation where we're using any kind of excessive force or trying to injure somebody in order to help them. So that's really what we try to do.
Great, thank you. Unless there's other questions, Mr. Chair, I'd like to move that we accept this final report and accept this report.
We've got a motion first.
I'll second.
We have a second. Any further conversation? Do you have a question?
Yeah, I mean, it doesn't pertain to whether we approve it, but
Okay. You can ask the question.
I was just wondering how, as the program's matured and sort of you talk about more people understanding it, have you seen the types of calls that you are responding to sort of change, or what percentage of calls change you responded to? And how does that sort of comport to how you envision the program sort of being effective and interacting in the community?
I think we still respond to the same types of calls, but I think there's that element of the community that knows that we exist now. And I think the change that we've seen is that they're actually asking dispatch when they call for help, hey, can you please send a co-responder unit? Now, we only have coverage from 7 in the morning till midnight, so sometimes that's not possible. But if it's not an emergency situation, sometimes that information can hold, and then when the co-responder unit comes back on the next day, they can take it. I think we're still responding to a lot of the same types of things, though: suicide attempts, suicide threats, a lot of calls where people are acting strange or acting violent in the community that we need to respond to, where threats are being made, that type of thing. So I don't think the call types have changed a whole lot, but I think there is definitely a big difference in that people know that co-response exists now, and so they're asking for that service more and more. And I think that was really part of our goal all along, was to first of all start our unit small, like all units start, and then build up. And part of that build up was to educate the community about what we do and how we do it. And then the comprehensive work we did on our website to try to explain that a little bit more, so that people can look at our website and refer people to our website, even when we contact them in person. Hey, there's more information, more resources that you can access on our website. That was really part of our goal in expanding, was to make sure the community knew more about us and how we do things. And our primary goal is to save lives. It's not to arrest somebody for minor drug offenses or other minor crimes. We're really there to try to get to the heart of the issue and triage to the point where we know that this is a mental health issue or a substance use issue, and try to get them connected at that point in time with the right resources, so that we're not arresting people and putting them in jail for those minor crimes.
Yeah. Have there been any sort of specific types of situations that have surprised you in terms of being able to sort of effectively resolve things that maybe you weren't sort of initially envisioning?
I think anytime we have a co-responder team that's on duty, we're seeing a lot of the deputies actually calling for the co-responder team, and they encounter those instances where somebody's having a crisis. And it might not have even been in a co-responder call, but when they get on scene and they find out, hey, this person is pretty escalated, they will call for us to respond. And we've had a lot of success with that. So I think that's one thing that, not necessarily surprising, but that's one thing that I think has been a really good benefit of our program, is that we can help the rest of our patrol section and the rest of our community, even when it's not a mental health call, but there's elements of mental health or substance use there that we can effectively intervene and try to get the person connected with resources. So I think that's been something we've definitely noticed over the last year and a half.
Thank you.
You're welcome.
One more question.
Real quick,
Okay.
gotta make sure we get plenty of time for left on the.
You mentioned that you don't have that coverage after midnight. Is there any plans, or number one, do you see the need to look into seeing about funding that piece that's missing?
We're always looking at that. Right now, most of the calls that we get for co-response or mental health or substance use issues are coming in during the hours that we have coverage for. There's a few scattered calls that come in late or early, So I'm not sure that we would necessarily benefit from having 24-hour coverage at this point in time, but I think as the community grows and as things continue to change, I mean, that could be something that could happen in the future. But we are watching those numbers, yeah. Thank you.
All right, wonderful. We got a motion on the table. Anybody oppose the motion? Hearing none, that passes unanimously. Thank you for all your work.
Thanks, Council.
All right. Okay, so we've got a proposal here from the Family Center La Familia. If you recall, this was part of the work and funding we had for the health equity or the continuum of care through those resources. So we're going to ask La Familia, the Family Center, to come up and present their proposal.
Thank you very much. Good afternoon, council members. All right, well, thank you for this opportunity. Thank you so much for having me here. I would like to thank you first, before I start, for all the work that you're doing. I had the opportunity to look at the statistics and it looks like the numbers are declining, which is great. I know that there's a lot more that we can do together. I was also impressed by all the presentations here, so that's really amazing. My name is Gloria Cara. I am the Executive Director of the Family Center La Familia. We are a family resource center that has provided support for Latinx working families in Llama County for 30 years. Who's managing? Okay, could you go to the next one? I just realized that, okay, yeah, that's where I wanted to go. All right, so as I was sharing before, we have supported the Latinx community mainly here in Northern Colorado through our services. So our vision is to create a community where all the families are safe, supported, and thriving. The way we work at La Familia is through 3 pillars of service. The first one being the early childhood education component, where at the center we have right now we have about 55 children that they receive care from 6 weeks old all the way to 5-year-old. And we do support the families with any needs that they might have. Just last year, we added an embedded occupational therapy program, which has been very successful. The other program that we have is family support services. That is a strengths-based approach on how we can support families with the multiple needs that they might encounter in their lives. And that way we can support them by establishing goals. We don't tell the families what to do. We like to establish positive relationships first. And that way we can collaborate together in identifying, what they need and the best supports that we can provide. And the last program we have is that we work with the community more like on a macro level. Right now, if you think of a little bit of the statistics here in Llama County, we have 42 mobile home parks in Llama County. And if I'm wrong, maybe it's just a few numbers. I don't have all the numbers on my head. But we work with 10 of those communities through the MIBOS program because we are trying to support the leaders and the residents into being empowered and address the many issues that they're seeing in those communities. 38% of the Hispanic migrant Latinos in Llama County, they live in mobile home parks. So this is a big number and a population that normally cannot access many of the services due to many barriers. It could be a language barrier, it could be access, transportation. Just in general, I can say that the population that we serve has a very low awareness of the opioid crisis that we're trying to solve here. So yeah, if we want to go to the next one, please. All right. So as I mentioned before, thank you so much for the opportunity to present a proposal. And thank you for including an underserved population that is in high need of information, education, and awareness. So I would like to say first that we do not work on the clinical side like other organizations that have presented here in the past. We mainly work on the prevention and the education side. Because we have so close contact with the families here in the community that we can craft these culturally relevant interventions. So the proposed scope of work is in alignment with the requirements of the grant, which is equity focused, because of our expertise working with a population that is that's identified as migrant or Hispanic. I use Latinx because I want to be inclusive of everything, but I know that you mentioned Latinx. There's no right or wrong. I just want to provide clarification that just for me to make it easier, I say Latinx, and we're including these families that have settled in Northern Colorado. We have families that have lived here for like 30, 40, 20 years, and we also have families that have moved into this area, which is great. So we want to create a culturally competent and evidence-informed approach to educate, raise awareness, reduce harm, and foster social connections among the Latinx Hispanic adults to address the opioid crisis in Larimer County. This is going to be done through an equity-focused approach, participant-led, because we love to get the feedback from the community, but we want them to inform the solutions. As I mentioned before, we're not going to tell them what to do. They are the ones that know what's best for their family. So we work alongside them. Data-oriented, because when I heard from Jared that 2% or less of the clients that you serve in this location identify as monolingual Spanish or migrants, to me, that is, I want to say that it's shocking, but it's also an inspiration, because that means that many families might not be aware of the services that you provide here. And I personally, I came here when it was the grand opening, and then I didn't come back until today. So it's been quite a long time. We're hearing from families that they're not really aware of what is being done here. And sometimes they have shared in the past that when they try to get an Uber, that the Uber doesn't want to come all the way here. There's some bias, there's a lot of stigma when we're talking about substance use and how we are approaching that population. Can you go to the next? I don't know, in terms of time, I'm not quite sure how much time I have. So the first approved use is to increase social connections. Increase opportunities for social connection in order to decrease feelings of loneliness by creating safe spaces for people with marginalized identities. So what we're proposing under the first approved use is the creation of a Spanish-speaking peer support specialist training. I know that Yarrow Collective provides that training, but it's not in Spanish. So this is where we come into having a more culturally relevant approach by training at least 10 bilingual and bicultural peer support specialists that could not only be located here in Fort Collins, but we're talking about Loveland, we're talking about Estes Park, you mentioned EVIX. EVIX is also a family resource center like ours. We are affiliated to the FRCA, which is a statewide association. So we have a similar approach on how we work with families. So hopefully they can get funding as well. So we want to create these and we don't want to see like a one-time solution when we train everybody and then we forget about it. We want to see a solution that is going to have a long-term impact. If we have a peer support specialist located in Estes Park, for example, we want to continue that relationship, and we want to continue generating the data that is going to give us more information on how we can start crafting more programs for this community. So that's what I'm talking about, the scheduling of these gatherings to the peer support group is something that is going to be able to let families have that social connection, have somebody in the community that they trust, because what I'm hearing from the sheriff's office is that many people don't dial 911 because they're afraid, right? The way they're approaching law enforcement, sometimes the families that we serve, they just don't want to make the call. So, and this is something that we're hearing, and we're really concerned about that. Not only because it's law enforcement and we are aware of what's happening in our communities with immigration enforcement, But I feel that we can be more convenient and really bridge that gap and make sure that families are really utilizing the services that are available. So we can be that connector. I just want to say, I include data collection on everything that we do because I love evaluation. And, we are also a grantee from the Behavioral Health Services Office. And I think that the evaluation is going to give us so much information that is missing because all the presentations that I have heard in the past are missing that component of the Latino Hispanic migrant population. Maybe they're looking at it, but they're looking at it maybe at a different way. And I think this data collection could be so valuable and we can do it. Next one, please. So the next, the next approved use is the increased knowledge. I have shared before that this population has a very low awareness of what the opioid crisis means in Lamar County. When we talk about substance use, families might be perceiving that in a very different way because culturally speaking, maybe alcohol use gets normalized among this population and is not seen as an issue. Same thing with the medication. My mom was a hoarder of medication, trust me, and I grew up in Mexico and I was little and I remember that the medication was just like there, right? And this is just a personal note, but in the community, through the WhatsApp groups that they have, I see that there's a lot of misinformation because people are trying to access medication or people are trying to sell their own medication, which is really sad and dangerous, right? So how do we approach that? And how do we educate people to really have more, information and tools on how they can properly store and dispose of that medication? One of the points or highlights is like, what is that experience? When we talk about this facility specifically with Longview, we would like to bring the families so they can get familiar with the space, so they can ask questions, and we can collect that data that is going to help you to serve these families much better on a more culturally informed way. So I would like to share that 2 years ago in a collaboration that we had with Summit Stone, we were able to provide one educational session on how to administer the Narcan kits, right? Naloxone Narcan kits. I would like to say that the parents normally don't know much about this. The children that go to the school districts here, they access that information, but the parents are not knowledgeable about that. So there's a big gap of information. And I remember that my family support team had planned an in-person meeting, but then we had a snowstorm. So they said, we have to cancel, but the parents really wanted to have this information and they suggested going into a Zoom meeting, and 12 families joined that meeting because they really wanted to break the stigma and be able to talk to their children about, the use of substances in general. So I think that is very valuable.
I hate to do this, we have only 10 minutes left.
Okay, so
I'd love for
next
you
one.
to have some conversation.
Perfect, so,
Yeah.
no, I think those are the two approved uses, so what's on the next one? I just want to see, okay, well, if you had a chance to read the objectives, this is what we're proposing. It's not a specific timeline because I don't know if these funds gets approved, when will it start, but it's a 12-month, timeframe. So using the tools that we have, evaluation and data collection and social connection. You can go to the next one. So that's basically a summary of what we're doing. So if you have any questions, I'm happy to answer those.
Questions? Yes.
So I'm just curious, and thanks for the presentation and thanks for your work. I visited the center and I've been, we've been coming to the meeting boss meetings and things. Is that the two bounced together? So you're looking at almost 160,000 or just?
Yeah, so the requirement was to present a budget on each one of the approved uses.
Okay.
So I was just following the format that was shared. And I noticed that the format that I shared was missing the full budget, but I sent those to you on an Excel spreadsheet, but I can send you the cleaner version of it.
Okay, thank you.
Yeah, you-
Other questions? Yes.
Thank you for your work. I know Claudette has worked with you closely.
Thank you.
So you're looking to hire 10 peer navigators and get them trained. Who would you be partnering with to do that training? Would it be Summit Stone? Would it be who in the community would you be doing that? And I'm not sure I was clear on what would be the cost for that training.
Yes, absolutely. So we allocated $9,000 to be able to offer the training in Spanish. I'm thinking of Yarrow Collective. They are the first organization that comes to my mind. I know that Summit Stone can also do it, and maybe there's a statewide resource, but we want to keep it local. We wouldn't hire them. We would train people in the community that have those connections within their own communities. So we want to have those commitments of somebody saying, I am in Loveland and I would love to get this training. We would need to pay for interpretation and childcare because we want this to be barrier-free. This is how we work. So I hope that I answered the question, but I'm thinking of Yarrow.
So a follow-up question, then the peer navigators would be volunteers, or would they be part-time individuals, or what would be the compensation?
Exactly. So there will be compensation in the way that, because we want to add the data collection component, the evaluator would provide incentives. So because this is a 12-month thing, and by the time we train them, we're probably going to have only 6 months left. And we're going to ask them to do at least 2 gatherings and start collecting the data.
So when I was looking at this, it seemed like I'm stuck on salaries this meeting. It seemed like the salaries were awfully high if these are volunteers. Can you speak on that line item?
Yes, absolutely. So we're not trying to hire more staff. We want to use our own staff because this has an evaluation component. It has a data collection. We need to utilize our staff because they are the ones that have the relationship with the families. If you think of the MIVOS leaders, they would need to have that support in collecting the data, and then with us spreading the information and educating and coordinating the tour that will come to the Longview facility. So when we kind of broke it down, because we want to raise awareness, we want to utilize all the programs that we have into educating families. We're trying to reach 400 households. Normally, just this last fiscal year, we served about 615 unduplicated households. So in the proposal, we're trying to reach 400.
How is their salaries being paid now?
Whose salaries? This is for the family center staff, only for the ones that are going to be working in this grant. I don't know if that.
Well, if you already have the same staff, they have to be getting funded from somewhere. So this is on top of the funding that you've already gotten for their positions, correct?
Oh, no, this is, that's a great question. So we had a decrease in funding. So right now we have a 10% decrease in funding for our programs. So this would help, paying for the work that they're going to be doing, delivering all the goals of the grant.
Thank you.
Can you expand on your approach with the mobile home communities? Because 38% Hispanic Latinos live in a mobile home. That'd be significant. What's your strategy? Is it leveraging MIVOS or what to carry out those?
Yes, exactly. So it's all of the above. Because MIVOS has been able to train the resident, the leaders of these 10 mobile homes. There's a lot of collaboration. They have a monthly meeting. They are continually receiving training and all the technical assistance. So what's happening right now is that the model of MIVOS is turning into more like a council, right? The leaders are ready to be deployed. They are making so many changes in their communities. They're addressing many issues water shortages. You know, I know nobody wants to talk about water, but it's a problem. Exactly. So no, we want to talk about many things that they can be doing in their community. So this is the approach of MIBOS being that the technical support for the MIBOS leaders. And we are hearing that other communities are trying to join because they see the success that we have in the engagement portion. I can brag about that and say that we have a high level of engagement, you know, like when many of the organizations that are either from government or county or school districts, they approach us and say, we would like to collect this information, we would like to collect this data. We're working with Jared and Joe in collecting data because when they go with the city, for example, and say, I have a problem with this and that, the city would like to see evidence. So the residents are creating that evidence, they're creating their own data because we don't have the mechanisms here in the county or the city to establish that type of data collection that is neighborhood based. When you click on any system and you say 80524, well, that's everything, you know. 80524 is not really giving me any information. But we created through our systems a breakdown of those communities. And now we can say how many cases we have in Boulder Valley Mobile Home or how many families we're working with in, Hickory Village. So I think that neighborhood data that we're generating is something that no one else is really doing, and we need it because it's just back and forth and saying, we're having issues. And it's like, okay, well, give me evidence of that. Okay, here's the data of that.
Thank you for that. Council, we got 2 minutes left. I entertain any thoughts on an approach with this, or table this, whatever you guys would like, yes.
We certainly have this equity bucket, and this seems like that would empty the equity bucket. That's without the extra. And also know we have this other proposal that I know you might be interested in because of the lack of response there. So I'm wondering if we can maybe table this and maybe have the other group too and see how much money we do have for this. And if this is, because we also talked about helping children of parents who are either deceased or that are separated from folks that are having addiction services. So I'm not sure if, I think this is some good ideas here, because I know this is a great system, but I'm wondering, are we willing to invest the whole bucket in this, or what are we looking else to implement? And so I think this is some really great work, and I know that's I've seen this program grow and get really strong. But I'm also wondering, are we today ready to empty that entire bucket? I'm just curious what the council thinks about that.
Others?
We have other proposals coming in.
Well, we did get an email that process is starting with, of Augustus with EMIX would like to come and do a presentation. And I too think it sounds like a great program, but I would like to pause and just gather more, let those other opportunities be presented and then decide, what and how we should divvy up those funds.
We did reach out to 5 organizations when this money was allocated. This is the one. I do caution us on others just coming in and about and hear about it when that hasn't been part of the process. It may be fine, but and when do we have to have this funding? Because this is still for year 3. When do we have to have this?
I think that's the September.
Okay, so it's something we would definitely have to finalize most likely next month.
Next month.
Well, I'm not sure, you said we reached out to 5, but I'm not sure that EVIX knew this was up.
Yeah, that's part of the challenge when we're doing targeted. We
Right.
go through behavioral health, but we can't reach out to everyone because we don't have an RFP process. So we hear about things, but I think we've got 1 more month left to make this decision. So I just bring that up as something to consider.
Have we heard from all the 5?
Pardon?
Have we heard from all the 5?
Yeah, we met with them virtually, and so far La Familia is the only one that's put together a presentation.
Yes.
Wondering, if we voted to fund some of it, would you be able to start on some of those objectives if we didn't
Yes.
vote on all of it?
Yeah, exactly.
Yeah.
Because this is new to me, like this process. But when you mention EVIX, we have a good relationship with EVIX, so I don't wanna just say, oh, this is all for me. No, we have a good relationship. If you're willing to see a more collaborative approach with EVIX, I'm open to do that.
Well, the return funds allocating to that bucket, you still have that additional money in there too.
The 59,000.
52.
Whatever.
And I don't know, but I'm hoping we will at least allow, since it is similar kind of approach, I'm just, but I guess I didn't know we had, this was the only one out of 5, but
I didn't know that either.
we didn't know that until now, so I feel like, I think that's an okay approach to maybe, approve some of it and then allow maybe that September to be kind of, or if they can wait till September. I mean, I agree we have to get it approved, but I see Janelle has her hand up.
And I would just ask that you all decide on a Exhibit E approved use. This is Schedule B, and so it's different.
Yeah.
The Exhibit E is very specific on.
Right.
And so it's, I would just ask that if you're approving anything today, that we consider that piece of it. It has to be put
So
into.
let's make sure we're clear. So this isn't, what's been proposed is not part of the,
So I see one, so Exhibit E G0, which is prevent misuse of opioids, supports efforts to discourage or prevent misuse. That's one budget bucket.
under
Yeah.
the
Yes,
equity budget.
so it's not in equity, we would have to move it, we would have to change the reporting for the state, which is fine.
Okay,
But we would have to identify that, and the second one, I'm not seeing in the Exhibit E, so that must have come from Schedule B.
okay, that's good to know. Thank you for sharing that.
Okay, so let me just clarify if I may. So the second paragraph there is not one of those that we have picked out to fill our bucket.
Yes, and it's very confusing, they have, the Colorado Attorney General has a Schedule B, which kind of lays out everything that's in Exhibit E. But it's really, what we have to report on is what's in Exhibit E, and it gives all the descriptions.
Right, but then from Exhibit E, we narrowed down those areas that we wanted to concentrate on, and you're saying this one doesn't fit in any of our buckets?
The first one.
Just the first one, correct? I think the second one.
I don't know, let me double check that.
Okay, so, Mr. Chair, I think we should first vote on extending our meeting real quick, because we're over time. So I make that motion that we extend our meeting for 10 minutes. We may not need the whole 10 minutes, so we're not over our time. And
There's a motion to extend the meeting by
10 minutes.
10 minutes? Is
I'll
there a
second.
There's a second on that motion. Any conversation? Anybody need to go? All right, although anybody oppose that motion? Okay, we've extended by 10 minutes.
And then, Mr. Chair, I think since there's a little bit of confusion here in the schedule, so we want to make sure we're making the right motion. I move that we table this conversation and maybe ask staff to maybe help support Gloria with making sure we have the right buckets identified for this. And then also I ask that we maybe invite the other events to present as well.
Okay, so there's the motion I'm hearing is table this, staff work with Gloria, so we make sure we get it right in Exhibit E, where the money was allocated, and you want an official invite to the event. Okay. Does anybody second that?
I'll second.
We have a motion and a second. Any further conversation?
Will they be able to present on this?
Well, they will have to, yeah, and that will have to be up to them.
I would like to do it in August. I'm sure we can maybe figure it out.
So the invite would then be for August?
Yeah.
Okay.
Sorry, I didn't clarify that. I'm,
No, that's fine. It's fine.
my brain is like, is it July or August? It's been a long day.
Okay. And if they didn't come in August, that would mean yep.
Yeah.
Okay. That's
The
very much-
opportunity to.
Any other questions or conversation regarding this motion? All right, all those in favor of the motion, signal by aye.
Aye.
Aye. Does anybody oppose it? Seeing none, that passes unanimously. Thank you so much. We will get you coordinated with staff and then we'll bring it back for next meeting.
Absolutely.
Okay,
And I'll just do a really 1 minute or 2 minute update on the
sure.
next item. So we met this week with the Opioid Abatement Advisory Group. Trustee Mason, or Mayor Pro Tem Mason and I did that. And I just wanted, we're calling it the OAAG, the Opioid Abatement Advisory Group. So here's a couple of, and thanks to Kavi for helping me narrow this down to a shorter presentation. But first, we have a grantee technical assistance update. Butler Group has completed outreach to grantees so that everyone noted an opportunity for technical assistance coaching for their evaluation efforts. So far, one grantee has scheduled with them, and I think they'll continue to do that. To reach out, outreach, I assume, and I'm sure they'll clarify that's wrong, but I know they've been trying to reach out to all of them. They will also be providing periodic outreach to grantees on evaluation and developing materials that may be helpful to grantees. And this will help provide information input to build toward a cross-site evaluation for the ROAC. Next, they did the environmental scan, and that report's almost done. We got to see a little bit of it, but they presented a scan of the grant administration practices used by ROACs across Colorado to provide information for Region 2's consideration and effort to continue to ensure alignment with the Region 2 ROAC's goals and principles, and recognizing that each county is distinct and has a different set of resources and needs, and this group is brainstorming ideas to build on Region 2's current grant administration practices, and that will be discussed and considered for a presentation to ROAC in the future. And that was a really great presentation, and appreciate kind of the facilitation of that. And then membership, we're strategically expanding the membership to request more perspectives and voices, and that we'll report back on that. And then the group will also be working towards focusing 1 to 2 meetings per year specific for grantee participation to support their work and also facilitate any input and recommendations from the ROAC. And Laura Walker from Larimer County has created a draft charter for the group that is currently under review by the group. And that idea is that instead of having them be a grantee that gets approved, they could be moved maybe under by charter into administrative expenses. And that might give us a little more money for things in the future. So that is forthcoming. And that's all I have for today, other than I'd like to share also, Mr. Chair, I did attend the National Association of Counties, and I apologize, I didn't get home today. It's been this big announcement from the federal government kind of turned my day today. But I was going to bring some of the things I learned. One of them is called a purple box. I guess it's been used a lot in Colorado. But I just wanted to let you all see it. It's a box that has Narcan, and inside is you can put it in places that has a video. So someone can play and watch the video. So you put them in like remote rural locations possibly. And I dragged it all the way back on the airplane from Philadelphia. But I wanted to share that with you. We obviously wouldn't have time today, but I wanted to be able to maybe show you all that next week, and something maybe we might want to consider for rural access and intervention. So just wanted to share that, and lots of AI stuff, but still a lot of opioid abatement things at a national conference. Thank you.
Thank you for that update, and thank you for your work on that. And the advisory group, that seems like you're doing a lot of work. Yeah.
And Mayor Pro Tem and Kavi and everyone behind it, it was a great meeting this week.
Oh, sounds like a lot of coverage. Anything else for the good of the matter? Hearing none, I'll entertain a motion to adjourn.
Move adjourned.
All right.
Second.
Yeah, motion to adjourn. We're adjourned. Thank you, everyone, for your hard work.
Thanks, everybody.
Thank you, Brian.